So good afternoon and hello everyone. Welcome to today's event, Ask Me Anything, Stay Sharp, Microplanning for Flu and COVID-19 Vaccines webinar, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleague, Sarah Price, Deputy Director of Public Health Integration. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been automatically muted and will be muted for the duration of this event. The duration of the event is approximately 30 minutes, including introductions and, of course, a live Q&A. Again, the duration of this event is approximately 30 minutes, including introductions and a live Q&A. During today's session, we will have the Q&A box open and ready for you. We do have some pre-submitted questions, which we will go over first. But again, folks, as you are logging in, as you're thinking about topics, feel free to put those questions into the Q&A box. Simply type your question, submit to all panelists, and make sure you hit the send button so we get that question. If we cannot answer your question in the time allotted or we need additional resources to review, an attempt will be made after the webinar is completed. Friendly reminders that today's event is being recorded. All attendee lines have been muted. The Q&A box will be open for the duration of this event. Feel free to type your questions into this box at any time for the duration of this event. Again, if we cannot answer your questions in the time allotted or we do need additional resources, we will make an attempt after the webinar is completed. And then after the webinar, you'll be presented with a brief 4-question survey. This survey lets us know how we did, how valuable this event was to you, and briefly informs us of future training and technical assistance. But while we get started, I'm going to turn things over to my colleague, Sarah, who will be introducing our speaker. Sarah?
Awesome. Thank you so much. Good morning and good afternoon to everyone on the call today. We're really excited to be able to offer this as a resource. We know all of you are deep in immunization work, both for flu and for COVID, and so we're so delighted that we have this venue by which to answer some of your questions. As Elizabeth stated, it does say Ask Me Anything, but we also know that some of your questions may need a couple other resources too. So again, if we don't get to your question, we are happy to take back that question, get it answered, email you back with that, or we'll address it on another call. This is a series. We'll be having at least 6 of these events through January and perhaps beyond that, as long as the questions keep coming. We are so delighted today to highlight the partnership between NAC and the Association of Immunization Managers. Today we are delighted to have Claire Hannon, who is the Executive Director at AIM, to be our person that we are asking anything today. She has 23 years of experience in children's health and immunization, and she served at AIM since 2004. AIM is a nonprofit membership organization that represents public health immunization programs, and so she works closely with the members of that organization and then other partners as well to improve and increase state and local public health immunization efforts. We have been doing a lot of work together, as you imagine, really combining the public health folks with the community health folks, and so we're happy to continue that work together. So as we get started, we will get to questions, but what I'd like to just kind of do is give Claire a minute or two to really just kind of express, what are some of the priorities that her and her organization are handling right now as it relates to both flu and COVID-19 vaccines, to kind of lay the groundwork for our questions that we'll be addressing today. So Claire, take it away.
Thank you so much, Sarah, and thanks to NAC for reaching out to work with AIM. This has been a great partnership, and really looking forward to that continued collaboration as we move forward. I was a little bit nervous about the Ask Me Anything, but I've got my little rock star studio here and listen to my theme music, so I'm ready to go. I would say that for immunization at state immunization programs, what's happening now, just to give you a little background, with flu, of course, we're coming up on, the flu week and really pushing flu. We've had immunization programs did get supplemental flu funding this year, so they are doing much more communication and outreach than in previous years. And so they'll definitely be pushing that, in December, working to try to make sure those late season doses are used. And I know community health centers are just playing a huge role in that. So we're really glad to see that. And some of these, I guess it was about 9 million additional doses that CDC ordered going to community health centers, and we want to help support you and make sure that those are used. So we have that going on. With regard to COVID, and I think that's where most of the effort is happening right now in immunization programs, planning for the COVID-19 vaccine campaign. And basically what's happening is that we are preparing for the potential emergency use authorization of the Pfizer vaccine, followed by the Moderna vaccine, and states have received an allocation, basically a first initial allocation of Pfizer vaccine, and then some estimates for additional allocations in December, and then some estimates for the Moderna vaccine. They've also received the prioritization guidance that ACIP passed on Tuesday, which says that healthcare workers, healthcare personnel, and long-term care facilities should be prioritized. So that's really where they are. They need to submit their enrolled providers for Phase 1A by today, get those providers up, make sure that their provider profiles are entered into VTRACs, make sure their data use agreements, so they have their data sharing ready to go with CDC. Hopefully all states will be able to get that in today. And any places where they want initial vaccine shipped to pre-position so that enough at the site when the ACIP gives the recommendation, they need to get that in today. So that's what's happening, but we still do have a ways to go. FDA reviewing the data right now, their independent advisory committee meeting on December 10th. And following that, the Advisory Committee on Immunization Practices will meet and make a recommendation. So the emergency use authorization, the recommendation is still to go, but states right now finalizing their plans for where the vaccine will be shipped for Phase 1A. So that's a handful. That's a lot, but I wanted to just set the ground. And yeah, I'm happy to answer questions. Let's see how this goes. Let's see where this takes us. And just really excited to have this ongoing conversation with you. As we start vaccinating and, as we're kind of going through this together. So, we'll see where this takes us.
Thank you so much, Claire. Thanks for kind of laying the groundwork for that. And we'll try to include just a quick update every time we have this session as well, just so we see how we are. So the focus of these Ask Me Anything, we're calling it microplanning. And so microplanning in the definition that both AIM and ACT have been using is really taking that macro plan that comes from CDC and so many others about how dosing, will get to all the way down to public health departments. And then because our audience is mostly health center networks, PCAs, and health centers themselves, is how to take what we know about microplanning and really microplan for those sites specifically. So if maybe some in our audience are nurse immunization managers at health centers, or maybe you're at the PCA level and you want to be able to broker some of the relationship between public health and community health. So those are the kind of questions I think that will be coming up on these. We have a couple, so we'll get started with those. But attendees, please feel free to go ahead and start typing in questions. And again, we'll get to as many as we can. One of the first questions we have, Claire, and you kind of addressed this, but I think it's worth a revisit as well, is how are other facilities going to plan for distribution to employees and patients when they have limited supplies and maybe a limited ability to be a mass distributor? Any specific techniques or any communication they should have with their public health department about the capacity that they have for flu or COVID vaccine? This is specifically to COVID.
Yeah, so I think that's a really good question, and I think it's obviously it's been very difficult for hospitals, for health centers, to sort of map out and plan when we don't know everything about the allocation, about how much vaccine will be available, and about who's prioritized. I would suggest that you look over the ACIP guidance. So the Advisory Committee on Immunization Practices, they hold open public meetings. And so all of their previous meetings are open to the public. They're on the website, and they're the previous slides. And some of them can be very helpful as you start to look at how should I plan for this. And most specifically, on Tuesday when they met, they really went through some of their logic around why they're prioritizing healthcare personnel and why they're prioritizing long-term care facilities, and how to prioritize within those priority groups. We do anticipate them issuing more guidance in that area when they actually put a recommendation out, but you can see what they're thinking. They talk about looking at which healthcare workers might be more at risk, which have more contact with COVID, which healthcare workers may have had the disease in the last 90 days. They may not be as at high risk. So just looking at some factors on how within your facility you can prioritize. Another thing that was discussed is that the vaccine, it does produce a reaction that seems to be more than routine vaccines or vaccines that we're used to. So the reactogenicity is higher. So they're suggesting that within healthcare facilities as they vaccinate, to stagger the vaccination of their employees so that if employees do experience a low-grade fever or a headache or myalgia, they won't have all of their employees experiencing that on the same day. So I think you need to think about, your storage and handling capacity, what kind of space and refrigerator capacity you have, and then, looking at your workforce, looking at the ACIP guidance, and thinking about staggering your employees and, are you able to vaccinate them, or will you need assistance or help with that? Kind of laying out those things. And I do think that state calls with stakeholders, inviting their hospital associations, hopefully, they're having some with you, the community health centers, and others, to provide information on what the state is thinking. It is changing rapidly. As their allocation has changed over the last week, they may have changed what they're thinking as far as, are we going to vaccinate healthcare workers first, or are we going to do long-term care facility residents first? How are we going to vaccinate healthcare workers that don't work in hospitals? So you should be able to, and if you need help with that, we can try to help with that. Get called in or get access to stakeholder communication from the state about how things are going to be rolled out in your state.
Great, thank you, Claire. An additional question that's come in that kind of goes along with what you were saying. This question is from one of our attendees. Will health centers with sites in multiple counties receive vaccines for their providers in each market from the individual local health departments? So I'm guessing that's some of our facilities are spread out throughout the state, but it would be considered kind of one provider, but with multiple locations. Any guidance on that?
So I'm not sure how that would work in each individual state, but I do know when you enroll as a provider, you would basically enroll as a site, and then you're going to list all of the providers within. So if you wanted to enroll as a network, you would list all of your providers within your network, and you could list the different sites, and then you also complete a provider profile so that you would be able to, to indicate where you have needs and where you have patients. And then when we get to a point where all of the enrolled providers will have access to vaccine, you would be submitting your orders, your requests to the state So you could say, you could request that I want 100 doses at this location versus that location. So I think it's really a matter of enrolling and providing that information clearly. And then, I think as far as how orders are processed and, how the provider enrollment is processed, it kind of varies by state.
Great. Thank you, Claire. On the enrollment, is there any deadlines for enrollment to be a COVID-19 vaccine provider?
I don't think there are any hard deadlines. I think a few states do have, goals where they want to get providers enrolled by a certain date, but I can tell you that the provider enrollment is going a little slower than we anticipated. And I think, I think there's just been a lot of questions from providers wanting to know more information, and states don't necessarily have a lot of staff capacity. So they really focus on getting phase 1 providers enrolled first. And now they're moving out to additional providers. So there may at some point come a hard deadline, but right now I think states want as many providers as they can get to enroll. And so, I'd say sooner rather than later, but I don't know. I'm not aware of any hard deadlines.
Great. Thank you. Thank you. And just as a note, I know Claire has referred to the ACIP guidelines and, any other resources that we refer to on this call. We have wonderful folks in the background that are keeping track of that, and we'll be putting those all on our on NAC's COVID-19 website. We'll make sure we'll put that in the link as well during the chat here, and as well in the FAQ document, so everyone has access to those things as well. Let's move a little bit, if we can, Claire, to talking a little bit about administrating the vaccine to patients. And again, if we need other resources to answer this question, that's totally fine too. But there's a little concern with patients who may access care and get a COVID-19 vaccine in one state or one jurisdiction, but then move between 1 to 2 doses and go to another state or jurisdiction. Is there kind of work behind the scenes on a way to link patient records in an IIS? We know patients will get the paper card, but we also know that doesn't always follow patients. So is there, do you know of any work behind the scenes about how to link to ensure that patients are getting both doses? If that's the
Really good question. And I think getting the paper card is like the backup to the backup, right? So state immunization information systems, are really the primary data collection source for doses administered. And they have the capacity to, to track the dose, the brand, and to make sure the person is getting the correct brand for the second dose and to send that reminder out. However, if, as you said, someone is in one state and goes to another state, that is a bit more of a challenge. And we've been working really hard to have a connected system. So states have been signing onto the IZ gateway. In any state that is signed onto the IZ gateway, their state IIS system can then access another state IIS system that is on the gateway. So that's one way a state will be able to query and find out, just check the record if someone got a vaccine in another state. There's also, for states, I don't know, I'd say more than half of the states are on the IZ gateway, but not all of them. So CDC is also setting up a clearinghouse that will have the ability to query, and but it won't be providing access to personally identifiable data to CDC or HHS directly. So that's sort of the secondary backup, and that's something that's new. So I do anticipate there may be some challenges with execution of that. But every state is signing a data use agreement with CDC to send information into this clearinghouse, and that will be queryable if someone presents in another state for the dose 2. And then, of course, the backup to the backup to the backup is that folks are getting a card. And so, you know, they should take a picture of the card. They should have the card. In many states, consumers can also access their own immunization record in their own IIS in that state. So they would be able, even if they were in another state, they would be able to check their record. So there's a number of things going on. You know, it's probably not going to be perfect. Some of these data systems are new, and of course, connecting across states has always been a challenge, and it's been an incredible feat to get this data use agreement written, like 17 pages, to get it through CDC's lawyers, and now each state going through that process, and some states having some difficulty with one area or another due to state law. So there's been a lot of working through those challenges, and it is our hope that every state will have signed the DUA and will have that mechanism of sharing data that can be queried into the clearinghouse or through the IZ gateway or, you know, as a last resort, the card.
Excellent. Thank you, Claire. I think you know, that's been a question that's come up on, I know, probably to you several times, as well as during this call and other times. We only have time for one more question, and I actually want to back up a little bit because, again, this is on microplanning also for flu. So we talked a lot about COVID-19, but we know that, you know, getting the flu shot is more important than ever now. We know that starting December 6th is, you know, National, I'm going to say it wrong, but, you know, flu shot week or whatnot.
Right, that's what I call it, flu shot week.
It's National Flu Shot Week. Perfect. Sorry, it's just easier. Exactly. And, you know, we together, our organizations have, you know, tried to really work on getting the communication out there that there are these, you know, free flu doses that were allocated. It's 3.6 million specifically to community health centers. And so what would you say, you know, if there's someone on this call that just, you know, hasn't heard about it or doesn't know exactly how best to access those doses, what would you say is the next thing that they could get off this call and try to get some of those free flu doses? What would be the best step for them to take?
You know, they should contact their state or local health agency. And if they don't have a specific contact there, we can help with that. Many of these doses, well, all of these doses were pre-booked. So that CDC would know how many doses to purchase. So they were pre-booked back in June or July. But we do have a way of communicating, states have a way of communicating through CDC and shifting doses around. So there may very well be additional doses available. And they should contact their state health department, their immunization program. We can help with that if they don't have a contact person there.
Excellent. Thank you so much, Claire, for that. That is currently all the questions that came up for this round. We want to go ahead and just let everybody know kind of the next steps for some more information, to get more information and some contact information for you all. So thank you so much, Claire. Hopefully we didn't rattle you too much. You'll come back next week.
I'll be back next week.
Perfect.
I'll work on my brevity so we can get more questions in.
No, that's totally fine. That's totally fine. And I think we'll probably get more questions as time is allotted. Just want to share some additional NAC resources for you. So first of all, December 16th, there is going to be a COVID-19 webinar held by the National Association of Community Health Centers. It's going to be a 3-part webinar series. The next one is part 3. We've already had 2. And this one is called Looking Over the Horizon. And so really looking at that recovery period after and whenever this is all over. So if you haven't registered for that, if you actually hold up your phone to the screen right now and scan that QR code, you can register for it. So please go ahead and do that. Next slide, Liz. And then just as a reminder, this Ask Me Anything, this was not the last time that you can join. We'll be doing every Fridays except the Friday around Christmas and New Year's. We did not expect that might be a high priority for people during their Fridays. But we'll be going through in January and then as needed. So please feel free to log in every Friday. We'll have different questions and hopefully all the answers during that time. So we'll see you again next Friday from 12 to 12:30. Also wanted to mention that all of the resources that we've mentioned, plus kind of a write-up and an FAQ of the questions that came up today, are going to be put on a new CDC COVID page on our NAC website, which is called Building the Capacity of Health Centers to Respond to COVID-19. So if you just navigate over to NAC.org, I think it will not be too hard to find, and you can go ahead and see all the resources there. I neglected to put my email address on there, but if you have any questions in the meantime or just want to connect or need help, Ellen's about to put it in the chat, but it's also just pretty simple. It's sprice@nac.org. And so I'm happy to triage any questions also back over to Claire and her team or take questions that way. So we will stay on for just an extra minute. If anybody has some additional questions, I'm just going to roll through, but we wanted to make sure we got some of those important announcements out for you as well. Let me scroll through. Let's see what we see. I think that's all.
I would just say too, like when you get the ACIP, they have several presentations around the safety of the vaccine. There's just a lot of very helpful information there. So, and I assume that FDA will have that as well when the VRBPAC committee meets. They will have a lot of basic information about the trials, the safety, how the safety is going to be monitored. There are several different systems monitoring that. So, Sarah mentioned, we'll share that ACIP information with you, but some of these presentations are really helpful to have.
Great. Hey, we had one last question sneak in, Claire, so don't leave yet. How does a clinic register to become a vaccine clinic for COVID-19?
So that is, you do that with your state. And I was just thinking as we were talking that we should try to get, we currently have a spreadsheet with all the state plans on it. We may try to do a spreadsheet that would have all of the information listed on how to enroll as a provider. But you should be able to go to your state health agency website, and there should be a link or some kind of place to enroll as a COVID-19 provider. And if there isn't, if you have trouble finding that, shoot me an email. I can help you with whatever state you're in, but it is state by state, the provider enrollment process. And yeah, you'll have to do that. There are a number of requirements, but the ones that you would expect, giving the vaccine for free, following the guidance, reporting the dose administered, things like that. That's what's involved in the enrollment process.
Perfect. Thank you, Claire. And yeah, to reiterate, if you have any barriers to doing that, any of you on the call, please reach out to Claire or myself. We are happy to facilitate that process for you. We are at time. Thank you all so much. Thank you for the attendees. Thank you to Claire and her team. Thanks to the NAC team behind the scenes running all this, to both Liz and Ellen. Thank you so much for your help. And we will see you all again next Friday. Tell your friends all about it. Have anybody else join us next week. Thanks so much. Appreciate it.
Yeah, thank you. Thank you, Sarah. See you next week.
Yes, you too.